time for your morning checkup, which this morning focuses on a national effort to get more people involved in research. It is called the All of Us program, and it's wrapping up a local stay today. WISH TV medical expert Dr. Janelle Gordon talked to those directly involved in it and joins us now. Who'd you speak to and what'd you learn?
Thank you, Scott. I actually spoke with the NIH's Chief Engagement Officer for this program, Dr. Kareem Watson, as well as the All of Us Tour Manager, Keita Hall. I wanted to learn more about the program, how successful their stop in Indianapolis was. Plus, Keita told me she's a part of this effort for a very personal reason.
So the All of Us Research Program is the NIH's, the National Institutes of Health, initiative to engage and enroll 1 million or more people and to collect data from 1 million or more people. And then, unlike some research studies, Dr. Gordon, where you answered a particular research question, All of Us is looking to collect data and to make it readily available to researchers so that they can ask questions from a diverse data set that they have typically not been able to ask before.
Indianapolis has opened their arms to us. We have already been here for 3 weeks, so not counting this week, we have had 88 participants become our partners, and hopefully the multiple seeds that we have already planted will allow people, even after we leave, decide to become one of our participants.
And as a cancer disparities researcher, Dr. Gordon, one of the things that I saw was that the screening, prevention, and even the treatment regimens that were available, particularly to marginalized communities, were often not made with those communities in mind. They often were not developed. And as a primary care physician, you know this. The screening guidelines are often not developed with the populations who carry the greatest burden of disease included in those research studies. And as a result, we know that there's sometimes a lack of generalizability to the results that we see.
What made you want to be involved in the All of Us study with the NIH?
Well, I actually am a participant and a partner myself. I currently have endometriosis, but my sister doesn't. My mother does, but my grandmother doesn't. And this has been around for decades, and there is still no cure for it. It could take years before it's actually diagnosed because doctors do not understand that there is a more problem than what is normally going on in a woman's body. So I want this to change. And when I looked at the research directory, I saw that there were, I think, over 20 studies right now when it comes to endometriosis. So I'm very excited to see if that comes out in my generation or if it just helps my daughter.
Today is the last day the All of Us exhibit is here in Indianapolis. The tour actually will be visiting my alma mater, Winston-Salem State University, next month.